In our previous lesson, we discussed about malaria. What is malaria, what causes malaria, and how the cause causes malaria. And in this lesson, we shall discuss about the signs and the symptoms of malaria. How will I know that I'm having malaria and not any other disease? These are the signs and the symptoms that I can see from how I feel that I'm having malaria. I can even suspect that I'm having malaria and go to the hospital. So some of these signs are cold and fever. One may feel very cold on a sunny day and may feel extreme fever in a cold day. That is one. Another one is severe headache. A headache that is not ceasing, either at night or in the day. The headache is severe. Pain in the joints. You feel pain in all the joints of your body. It may cease in 1 minute, then come back in another minute, but it is persisting. Then we have general body weakness. You just feel weak. You don't want to do anything. You are not even capable of doing anything. So the whole body become weak. Loss of appetite. You don't feel like eating anything. And if you eat anything, then you vomit. You may also feel nausea. Nausea is that feeling of vomiting, but you are not actually vomiting. You feel you are just about to vomit, but you can't vomit. So that's a feeling of nausea. Since the plasmodium affects the red blood cells, the patient becomes anemic. This is lack of blood in your body because the red blood cells are affected, and we said the function of red blood cells is to regulate your oxygen in the blood. So you become anemic because once the component of blood is affected, which is capable of regulating the oxygen in your body, then the production of red blood cells, or the production of blood, the red coloring matter of blood, is reduced, so you become anemic. All those are signs and symptoms of malaria. Once you experience them or once you get them, it is advisable you go to the hospital before the pain and all these symptoms persist.